Assalamu alaikum, ya kan abdu, ya kan astain. So in today's video, I'm going to revise the surgery 20th Feb afternoon paper. So question number 1, a patient has the bradycardia and the low BP. Your investigation has low T3, T4, increased TSH. How will you manage the patient levothyroxine? Mixed venous blood sample can be obtained from the pulmonary arteries. SA node is located upper part of sulcus terminalis. Newly born child having the ossification center at which of the following, that is the distal end of the femur. Most superficial structure in the parotid is the facial nerve. Which muscle derive from the pharyngeal arch, that is the mylohyoid. The pregnant lady with the labor and obstructive labor was brought to the hospital, died. Reaching the hospital, most common cause would be the amniotic fluid embolism. The carcinoma of the glands and the clitoris lymphatic drainage goes into the uh, deep inguinal lymph node. The character which distinguishes Anthrax bacillus from the other organism is aerobic anaerobic atmosphere. The carbon dioxide and oxygen crosses the membrane due to the small size. The brain blood supply depends on the respiratory rate. From cranial to the caudal intercostal space is vein, artery, and the nerve. The resection of ileum more than 100 centimeter will cause the decreased absorption of the bile salts. The muscles in with the fascicle arranged in right angle to long axis is the parallel. The patient IVC blocked just above the emergence of azygous vein. Where will blood divert? There is azygous vein. Next, the first rotator of the arm is the supraspinatus. The pseudostratified columnar epithelium with the cilia is present in the trachea. The esophagus histology shows epithelium that has stratified squamous epithelium throughout. The female having UTI, gynecologist advised urine RE shows the pus cells. Organism is coagulase positive. Which organism is involved? The Staph aureus. The patient with well differentiated squamous cell carcinoma of the lung, histopath will show which of the following, that is the keratin pulse. The 17 ketosteroid increase in the adrenogenital syndrome. Next, the Bayer's block uses which mostly, that is the pilocaine. The young girl presented with the foul smelling pinkish discharge in the pearl shaped triphosphate, that is the Trichomonas vaginalis. The patient with the chronic diarrhea not responsible to the gluten free diet. Crease shaped organisms are seen near the bluish border. Diagnosis is the Gardiasis. The surfactant deficiency will lead to which of the following ARDS? The bronchial artery rises from which level? That is the T5, T6. Extradural hematoma is caused due to the rupture of which of the following vessel? That is the middle meningeal artery. Next, the kid with the meningitis develops bilateral deafness, that is the damage to the neural pathways. The right bundle branch is supplied by the LCA. Interventricular septum is damaged by which of the following valve? Most commonly affected, the tricuspid valve. Security guard had the history of fallen unconscious for the few seconds. Neurological examination is unremarkable. He is having irregular pulse. What will be the cause? That is syncope. The common peroneal nerve related to the bicep femoris is medially. Patient came in OPD with the recurrent calcium stones. What will you give for the treatment? That is thiazidatics. Next, ductus deferens different from the others by the thick layer of the muscular layers. Least dilatable part of the urethra is the membranous part. The femoral hernia gets strangulated due to the narrow neck of the sac. Intrahepatic protein anemolism and extrahepatic catabolism is the cortisol. The CSF examination necessary to rule out the retinoblastoma. The patient develops diarrhea after antibiotics use. Cause is the Clostridium difficile. That is the scamocolumnar junction. True is the GE junction. Regarding right shift of oxygen dissociation curve, what will be the P50 35? Next, the drug of choice of the tapeworm is praziquantel. HIV patient presented with the fever, neck rigidity, the meningeal irritation, halo seen around the organism involving the brain tissue. What is likely cause? That is the Cryptococcus neoformans. Most common cardiac tumor is the myxoma. Next, the fast-span fibers are A delta fibers. Commonly fractured bone in the hand is the scaphoid. Pectoris major flap will get blood supply from which of the following, that is thoracoacromial mechanism of the chloride reabsorption in the later segment of the proximal convoluted tubule is the passive due to the concentration gradient. 3 years old child was brought into the pediatric emergency with a bradycardia. His history revealed that he had swallowed coin 6 days ago. Now vomiting. Which of the following nerve responsible for the stimulation of one of the nerve supplying the larynx, that is recurrent laryngeal? In 2 days baby developed rash over her extremities. Mother had the untreated infection during the pregnancy. Which organism is transmitted vaginally? That is HSV. The patient has increased glycogen with the normal storage of the liver, no increase in the glucose. This is due to the deficiency of the glucose 6 phosphatase. Child with the multiple fractures, blue sclera. Uncle has similar condition, that is the autosomal dominant osteogenesis imperfecta. The female first pubertal changes would be thelarchy. Next is the 54, the Burgess lymphoma translocation. Which of these, that is the 8:14. Next, the main determinant of the coronary circulation is local metabolites and oxygen demand. Ventricles are commonly depolarized. In the ST segments, the insulin release is increased by the secretin. Which bacteria has no cell wall, that is the mycoplasma. After tonsillectomy, patient developed the harshness of eyes due to the damage of the vagus nerve. 25, cholecalciferol conversion occurs in the kidney. Next, the hereditary spherocytosis defective protein is which of the following, that is spectrin. Which structure hooks around the arc of aorta, arch of aorta, that is the left recurrent laryngeal nerve. The right bundle branch of the conductive system of the heart is present in the septomarginal trabeculi. The female presented the dysphagia to liquids for last 6 months. Angioscopy shows normal histology of the tract. The most likely cause is a loss of neuromuscular coordination. In inflammatory allergic nasal polyp, what will be found on the histology, that is the eosinophils. Next, the 66, the patient with a recurrent wheezing, nasal congestion, runny nose and the fever every April due to the degranulation of the mast cells. Dry heat kills bacteria by the oxidation. Next, the nucleus pulposus is derived from the notochord during anaphylactic shock. Histamine is released from the mast cells. Gastrocnemius size is reduced after cast applied for few days, with fracture most likely due to the decreased protein sensitivity and increased degradation. 85, the 85-year old male patient complains of lower backache. Doctor during the examination noticed an outcome with the tuft of hair at the L5. What is your diagnosis? That is definitely the spina bifida occulta. Next, the strand muscle resulting from the excessive eversion most likely demonstrate which structure damage, that is the deltoid ligament. The phrenic nerve supply mediastinal and the diaphragmatic pleura, and the damage result in the paralysis of the diaphragm. Major contribution to the phrenic nerve is which of the following, that is C4. Next, the human is the intermediate host for which of the following, that is the hydrated disease. The motor cerebral cortex function is the direct movement. 76, the posterolateral relation of the parotid gland would be the carotid sheath. The physiological shunt will be present when VQ is 0. Next, in the lateral rotation of arm, muscle involved would be the teres minor and the infraspinatus. Medial side of the scapula fractured. Which muscle is not damaged, that is infraspinatus. The patient came with gunshot injury to cervical region and the difficulty in breathing. Muscle damage would be the diaphragm. Next, the pregnant lady develop initial infection with a fever and the rash, then develop hemorrhagic signs. This is dengue fever. The calculate ejection fraction if heart rate is 70, cardiac output 5.6, EDV 160, that is 0.50. The heparin activates which of the following antithrombin 3. 6-year girl presented in the OPD with excessive facial and chest hairs, the adult size external genitalia and deepening of the voice. She also gives history of 2 siblings death suffering from the similar condition. Enzymes deficiency leads to death, that is a 21 hydroxylase deficiency. About vitamin D, true is 25 hydroxylation the liver and 1 alpha hydroxylation the kidneys. When P wave is not present in the ECG, what is the pacemaker located? Where is the pacemaker located? That is the AV node. Carcinoma of the granulosa cells of the adrenal gland lead to the hypernatremia. The high number of the blood transfusion of the blood from the blood bank is at the risk of the hypocalcemia. After mastectomy for the breast carcinoma, female develop winging of the scapula, which is due to the damage of the long thoracic nerve damage. Next, the medial cord of the brachial plexus continues as the ulnar nerve. The 18-year girl presented the epistaxis sigmosis of the bone marrow aspirate platelets low, hyperplasia of the myocariocytes. The diagnosis is ITP. There is an injury to the tendocalcaneus. Tendon function will be lost as a dorsiflexion. Next, 93, the patient came with gastric pain, heartburn on endoscopy, perforation of the posterior duodenum. Vaccine. Which artery is rodent in the duodenal ulcer? That is the gastroduodenal artery. Next, the part of pituitary gland and then fundibulum called the pars tuberalis. Next, the diabetic patient presented the OPD with the oozing greenish discharge from wound. Which of the following is the causative agent? That is the Pseudomonas. Organism which produce the fluorescent pigment resistant to the beta lactams is the Pseudomonas. Next, the patient having the fever, cough, and the sputum infiltrated on chest X-rays, gram-positive catalase negative organism oscillating in the culture is likely the Streptococcus pneumonias. Which the following factor is involved in listing DIC, that's the tissue thromboplastin. What joins one lamina to the upper lamina of the vertebra? That is the ligamentum flavum. Two kids bet on eye blinking. The one kid lost, and he as he blinked first. The blinking was due to the cervical segment of the spinal cord. The corneal reflux is by the ophthalmic branch of trigeminal nerve. Young thin lean boy with the sign of tetany, having calcium of 6 and unique excretion is 50. What would be the cause? Vitamin D deficiency. HIV patient with the fever from 4 to 5 days, vomiting, CSF glucose is 80, BSR is this. There's the protein is 45 with no cell raised. Cause in the HIV patient is the herpes encephalitis. SA node is supplied by the RCA in the 60% of the people. Inner plasma flow is measured by the PAH, paraminohipparic acid. The primary gravida with the prolonged labor in the lithotomy position was unable to walk properly after delivery. She couldn't dorsiflex her right foot, but now got pressed lower limb surgery. That is a common point of the patient. If the patient 25% nephron is working, what will happen in the remaining nephron? That is the increased GFR in the remaining nephron. The post-MI death on 4th day, findings in the biopsy of the left myocardium would be the necrosis, neutrophils and the macrophages. Cell outline is preserved in the coagulative necrosis. Next, the growth hormone inhibition. Which of the following there is somatomedian, that is the bone scan necessary for the retinoblastoma. Von Willebrand factor function is the platelet adhesion. Boy having the hemorrhoids and uncle had same problem, that is that is hemarthrosis, that is the consumptive coagulopathy. The patient the history of the fracture after a while developed crepitus foul smelling discharge. What will be the cause? The toxemic shock. The patient of the burn, the hypotension, the tachycardia, most likely diagnosis is the DIC. The patient having the retrosternal chest pain, nausea, GERD with the velvety esophagus and the columnar epithelium. Increase in the chance of which of the these, that is the Barrett's esophagus. The patient is the conscious admitted in the ICU due to the heart problems. What thing disturbs him most? Anxiety due to what is what is happening. The patient with the sore throat, fever, lymphadenopathy, Epstein-Barr virus was detected. He is at the risk of which of the following? The Burkitt's lymphoma. Mean is defined as the sum of all observation divided the total observation. Hepatitis B positive patient has the raised alpha AFP 1000. He might be having the hepatocellular carcinoma. The most common opportunistic infection after the kidney transplant is the polyoma. The patient had the cough and X-ray shows hilar lymphadenopathy and non-Kijitian granuloma. The diagnosis in this case would be the sarcoidosis. The dietary source of the serotonin is the tryptophan. The common cause of the prolonged BT is thrombocytopenia. The diabetic female having the chronic rhinosinusitis develop the fungal infection that shows septate hyphae at acute angle and the producing respiratory symptoms. Most likely fungus would be the aspergillus. The sterilization of the endoscopic instrument is by the glyceraldehyde. 2% patient with a severe headache, vomiting and the neck stiffness raised ICP on the lumbar puncture. There was blood stain CSF. Diagnosis is subarachnoid hemorrhage. Which of the following is the diagnostic criteria for the sarcoma? That is basically the increased vascularity. The patient has the following ABGs, that is the scenario of metabolic acidosis. Decision between the dialysis and the transplant is by the creatinine clearance. What is the common cause of anemia and the thalassemia? That is the defective hemoglobin genes, HP genes. Next, which of the defective HP genes. Which of the following used for the angina treatment? That is verapamil. Skin cancer most commonly associated with the AIDS in the homosexual males would be the Kaposi sarcoma. The absorption of the CSF occurs in the arachnoid granulations. Next, the Jackson toxicity is caused by the hypomagnesemia. The singer vocalus related to which of the following? That is the thyroid man determination of the coronary circulation is the adenosine. Following vein open into the atrium, that is the anterior cardiac vein. The superior artery is the branch of which of the following? There is external carotid artery. The parotid gland enlargement due to the stone in the parotid duct. What will the cause of death of cells in the gland? Apoptosis. On histology shows flask-shaped cells, multiple dendritic synapses in the cerebellar cortex. Breaking bad news: should ideally be attending doctor should tell in exclusive formal session. Patient presenting the shock-like condition after RTA, multiple soft tissue injuries. Cause of the shock in this condition would be the peripheral vasodilation. The prothrombin time detect falling clotting factors 1, 2, 5, 7, 10. The tricep reflex loss lesion is in the lower cervical after third week of the gestation. Blood vessels and the cells form type of the villus is the tertiary villus. Increased participation of carbon dioxide will cause the tachycardia. 7th month pregnant lady with the chronic ITP having ecchymosis in epistaxis. Platelets count is 5 to 10, and on the full steroid dose, what will be the next suitable step? The IV immunoglobulin. The chi-square test is associated with the 2x2 table to check the status of the vitamin A in a community. The most cost-effective method of assessing is the dietary analysis, which the following paraneoplastic syndrome is with the small cell carcinoma of the lung. There is the Cushing syndrome. Next, the patient finger cut. Doctor told him not to worry as all will be fine due to the regeneration of the stratum basale. The furunculus is in the tip of the nose, separate the cavernous sinus via the superior-ophthalmic vein. Pain of pericarditis is carried by the phrenic nerve. After chemotherapy, tumor size regresses by the apoptosis. The microbiologist was examining a slide under a microscope. It shows cell shrinkage, condensed nuclei in cells, irregular cell membrane of the cells. What is happening to the tissue? That is the apoptosis. Hyperpolarization of the neuron due to increase in flux of the chloride. Early adolescent with a prominent forehead, everted looking ears and longitudinal mandible. Hypogonadism. The diagnosis is of the Fragile X syndrome. Most likely for the cortisol is the increase after trauma. The patient was given penicillin for the some infection. He is allergic to the penicillin. What will be found in the blood? That is IgE. The correct sequence of the protein synthesis is the mRNA, cytoplasm, ribosome, tRNA, and the amino acid person stands from the swan position. What will maintain mean arterial pressure? That is the baroreceptors. Microscopic feature of the chronic disease of the liver in the hepatitis C would be there is the portal and the periportal fibrosis. Right lung has the bronchogenic carcinoma. Middle lobe removed. Surgery segments include the medial and the lateral, at which RBC nuclei disappear. That is the late pneumoblast. Fisherman presence of the gum swelling in the purpura. Likely cause would be the vitamin C deficiency. The girl has bronchial obstruction, but alveoli is still aerated due to the alveolar pores. The fenestrated capillaries mostly found in the kidneys. The common side effect of the protamine sulfate would be the hypertension. Next, the adverse drug effects are variable. A malnourished patient develops generalized edema due to the hypoalbuminemia, which is the following is locally malignant tumor. That is ameloblastoma. Acquired immunity is by the antibodies. Next, death due to hanging. That is odontite process is basically damaged in this case. He loss is controlled by the anterior hypothalamus. Drug with the maximum oral bioavailability is the propranolol. Patient after RTA above the sacral region of the spinal cord damage has which effect? That is the spastic bladder. Nitric oxide max limit for 8 hours is the 20 ppm. Next, the 6-month baby diagnosed with the whooping cough pertussive. Drug given for this would be the erythromycin. The patient undergoes the dental procedure and experiences loss of sensation in the affective area following anesthesia. Which of these would be responsible? That is the C fiber. Which of these get anesthetized first? That is the C fiber. So that's all from this particular video. Do subscribe my channel. Thank you for watching. Until my next video.